Welcome to today's video about side effects of gabapentin. Every single day, millions of people worldwide take gabapentin, a medication prescribed to treat nerve pain and seizures. But what many don't realize is that this widely used drug can cause changes in your body beyond its intended effects. Whether you're currently taking gabapentin, your doctor has recommended it, or you're simply curious about this medication, the information in this video could be crucial for your health. Today, we're exploring 10 side effects of gabapentin, backed by authentic clinical research and FDA documentation. From common reactions affecting daily life to rare but serious complications, understanding these effects helps you make informed treatment decisions. Stay with me through all 10 side effects because some information might surprise you, and knowing what to watch for could make a significant difference in managing your health. Alright, here's what you need to know. Let's begin the list of gabapentin side effects with number 1. Dizziness and vertigo. Let's start with one of the most frequently reported side effects of gabapentin. Dizziness stands out as one of the top 3 most common adverse effects documented in clinical trials. According to research published by the National Center for Biotechnology Information, dizziness occurred in approximately 13% of patients taking gabapentin in controlled studies. This isn't just mild sensation of being off balance. Patients describe feeling as though the room is spinning, experiencing lightheadedness, or having difficulty maintaining steady footing. The mechanism relates to how gabapentin affects your central nervous system by binding to specific calcium channels in the brain, altering neural signaling patterns that disrupt balance and spatial orientation. Clinical data shows this side effect tends to be most pronounced when starting medication or increasing dosage. What makes dizziness particularly concerning is its potential to cause falls, especially in older adults who may already have balance issues. Falls can lead to fractures, head injuries, and serious complications. The FDA-approved prescribing information for Neurontin specifically warns healthcare providers and patients about this risk. For some individuals, dizziness diminishes as their body adjusts to medication over several weeks, but others experience persistent symptoms requiring dose adjustments or alternative treatment approaches. Next, side effect 2, somnolence and excessive drowsiness. Moving to another neurological effect significantly impacting daily functioning. Excessive drowsiness or somnolence ranks among the most commonly reported gabapentin side effects. Clinical trial data reveals somnolence affects a considerable portion of patients. According to FDA documentation and peer-reviewed research, this isn't ordinary tiredness resolving with good sleep. Patients report overwhelming fatigue, difficulty staying awake during daytime, and persistent fog interfering with concentration and mental clarity. The drowsiness stems from gabapentin's effects on neurotransmitter activity in the brain, particularly impacting the central nervous system's alertness mechanisms. Research published in medical journals indicates this side effect is especially prominent during initial treatment phases, though it can persist throughout therapy. The implications extend beyond mere inconvenience. Excessive drowsiness can impair your ability to drive safely, operate machinery, or perform tasks requiring full attention and quick reflexes. The American Academy of Family Physicians emphasizes the importance of counseling patients about this risk, particularly given gabapentin's increasing use for various conditions. Healthcare providers typically recommend avoiding activities requiring alertness until you know how gabapentin affects you personally. For some people, drowsiness lessens over time as tolerance develops, but others may need dosage modifications. The severity can also increase when gabapentin is combined with other sedating medications, making it crucial to discuss all your medications with your healthcare provider. Next, side effect 3, ataxia and gait instability. Now we turn to a side effect directly impacting physical coordination and movement. Ataxia, characterized by unsteady gait and impaired coordination, has been documented as a notable adverse effect of gabapentin. Research data shows approximately 14% of patients in controlled trials experienced ataxia, making it one of the more common neurological side effects. This isn't simply clumsiness. Ataxia refers to loss of full control over bodily movements, particularly affecting walking and balance. A literature review published in MDPI examining gabapentin-associated movement disorders found ataxia was among the most frequently reported motor complications. Patients describe feeling unsteady on their feet, having difficulty with coordination, or experiencing wide-based, swaying gait. The mechanism involves gabapentin's effects on the cerebellum and other brain regions responsible for motor coordination. By altering calcium channel activity and GABA signaling, the medication can disrupt precise neural coordination required for smooth, balanced movement. This side effect carries serious implications, particularly for elderly patients who may already have compromised balance. Falls resulting from gabapentin-induced ataxia can lead to fractures, head trauma, and other injuries with potentially severe consequences. Case reports document patients who develop significant gait disturbances requiring medication discontinuation. Healthcare providers must carefully weigh these risks, especially when prescribing to older adults or those with existing balance problems. Dose-dependent effects mean higher doses generally carry greater risk for developing ataxia. Next, side effect. 4. Peripheral edema and swelling. Here we encounter a side effect that may seem unexpected for a neurological medication, yet it's well documented in clinical research. Peripheral edema, referring to swelling in the extremities, particularly feet, ankles, and hands, has been identified as a significant adverse effect of gabapentin therapy. A comprehensive pooled analysis of 3 clinical trials in patients with post-herpetic neuralgia, published in the American Journal of Geriatric Pharmacotherapy, found peripheral edema occurred with notably higher frequency in patients receiving gabapentin at doses of 1,800 milligrams daily or higher. The study showed 7.5% of patients on these higher doses developed edema, compared to 1.4% taking lower doses and 1.6% on placebo. This represents a statistically significant increase. The exact mechanism causing this fluid retention isn't completely understood, but researchers believe it involves changes in capillary permeability and alterations in how the body regulates fluid distribution. Patients often notice shoes becoming tighter, rings no longer fitting comfortably, or visible puffiness around ankles that worsens as the day progresses. While often mild and manageable, this swelling can be more problematic for individuals with pre-existing heart conditions, kidney disease, or venous insufficiency. Clinical documentation indicates this edema is generally reversible when gabapentin is discontinued or dose is reduced. However, while patients remain on therapeutic doses, managing swelling may require supportive measures such as leg elevation, compression stockings, or reduced sodium intake. Up to 8% of gabapentin users may experience some degree of edema. Next, side effect. 5. Weight gain. Weight gain associated with gabapentin use represents a side effect with significant psychological and physical health implications. Clinical research has documented this phenomenon, though incidence varies across studies. According to FDA prescribing information, weight gain occurred in a small percentage of patients in controlled trials. However, longer-term studies paint a more concerning picture. Research published in Therapeutic Drug Monitoring examined 44 patients taking gabapentin for 12 months or longer and found 57% gained more than 5% of their baseline body weight, with 23% gaining over 10%. A systematic review examining drugs commonly associated with weight changes found gabapentin users gained an average of nearly 5 pounds after just 6 weeks of treatment. The mechanisms behind gabapentin-induced weight gain appear multifactorial. Increased appetite is commonly reported, with patients experiencing stronger hunger signals and food cravings. Additionally, fatigue and drowsiness caused by gabapentin can reduce physical activity levels, contributing to caloric imbalance. A recent review published in Current Pain and Headache Reports noted weight gain affects up to 25% of patients and is primarily attributed to altered gastrointestinal function, peripheral edema, and reduced activity. This weight gain can have cascading effects on health, potentially worsening metabolic conditions like diabetes and affecting self-esteem. For patients with chronic conditions requiring long-term therapy, cumulative weight gain over months or years can be substantial. Healthcare providers increasingly recognize the importance of discussing this potential side effect before starting treatment. Next, side effect 6, Nystagmus and visual disturbances. Now we examine side effects affecting one of your most important senses. Nystagmus, characterized by involuntary rhythmic eye movements, along with other visual disturbances including diplopia or double vision, have been documented as adverse effects of gabapentin. Clinical trial data reveals these ocular symptoms occur with notable frequency. According to the U.S. Gabapentin study group trials, nystagmus affected 19% of patients, making it one of the more common central nervous system effects. Additionally, diplopia and blurred vision were reported in controlled studies. A comprehensive literature review published in MDPI examining gabapentin-associated movement disorders confirmed visual disturbances represent recognized complications of therapy. The neurological basis for these effects relates to gabapentin's influence on brain regions and neural pathways controlling eye movements and visual processing. By modulating calcium channels and GABA activity, medication can disrupt precise coordination required for normal eye movement control. Patients may notice their eyes making small, rapid, involuntary movements they cannot control, or they may suddenly begin seeing double when looking at objects. Some describe text appearing to jump or blur when reading, while others report challenges with depth perception. These visual symptoms, while generally not causing permanent eye damage, can significantly impair quality of life and pose safety concerns. Activities requiring visual precision, such as driving or operating machinery, become hazardous. FDA prescribing information specifically lists these visual disturbances among adverse reactions healthcare providers should monitor. Most cases are dose-related, with higher doses more likely to trigger symptoms. Next, side effect 7. Tremor. Tremor represents another neurological side effect affecting fine motor control and daily activities. Clinical research has documented trembling or involuntary shaking as an adverse effect in gabapentin users. According to FDA-approved prescribing information and clinical trial data, tremor occurred in 15% of patients in controlled epilepsy studies. A systematic literature review published in MDPI examining gabapentin-associated movement disorders identified tremor as one of the commonly reported motor complications, second only to ataxia among movement-related side effects. This isn't transient shakiness like what you might experience from too much caffeine. The tremor associated with gabapentin is characterized by involuntary oscillating movements, typically affecting hands, arms, or sometimes other body parts. Patients report difficulties with tasks requiring steady hands and precise movements, such as writing, using utensils, working with small objects, or performing delicate manual work. Medical literature indicates this tremor is generally classified as an action or intention tremor, meaning it becomes more pronounced when attempting voluntary movements rather than at rest. The underlying mechanism involves gabapentin's effects on neural signaling pathways, coordinating smooth muscle contractions and relaxations. By altering neurotransmitter release and calcium channel activity, the medication can disrupt precise timing required for steady movement control. For individuals whose occupations or hobbies demand fine motor skills, This side effect can be particularly limiting and frustrating. Clinical observations suggest the tremor is often dose-dependent, with higher doses potentially increasing likelihood or severity. Healthcare providers must distinguish between medication-induced tremor and other conditions causing similar symptoms. Next, side effect 8, headache. Headache has been identified as a relatively common adverse effect of gabapentin in clinical research and post-marketing surveillance. While it might seem ironic that a medication prescribed for various neurological conditions could itself cause head pain, clinical trial data documents this occurrence. According to multiple sources, including Cleveland Clinic and NCBI publications, headache appears among the frequently reported side effects, affecting a notable percentage of users. The FDA prescribing information lists headache among adverse reactions observed in controlled clinical trials. These aren't necessarily severe migraines, but they can range from mild tension-type discomfort to more substantial pain interfering with daily functioning. The pathophysiology behind medication-induced headaches involves complex interactions between the drug's neurological effects and various systems contributing to head pain, including vascular changes, alterations in neurotransmitter levels, and modifications to pain processing pathways. Patients describe various presentations, from constant dull aches to pressure-like sensations or more intense, throbbing pain. Clinical observations indicate these headaches often emerge during initial treatment phases or following dosage adjustments, suggesting the brain may be reacting to chemical changes induced by medication. For many patients, these headaches prove transient, disappearing as their body acclimates to gabapentin over 1 to 2 weeks. However, others experience persistent or recurring head pain throughout treatment course. Healthcare resources like the NHS advise patients that headaches should typically resolve after the first week of treatment, but to contact their doctor if they persist longer or become severe. Distinguishing between gabapentin-induced headaches and headaches related to the underlying condition requires careful clinical assessment. Next, side effect 9, nausea and gastrointestinal upset. Gastrointestinal effects represent another category of adverse reactions associated with gabapentin therapy. Nausea and various forms of digestive disturbance have been documented in clinical literature as side effects affecting some users. Research findings indicate patients may experience nausea, sometimes progressing to vomiting, along with other gastrointestinal symptoms such as diarrhea, upset stomach, or general abdominal discomfort. While not among the most common side effects, these digestive issues occur with sufficient frequency to warrant attention. The mechanisms likely involve both direct actions on the digestive system and indirect effects mediated through the central nervous system, as the gut and brain maintain constant communication through the gut-brain axis. Clinical trial participants have reported varying degrees of severity, from mild queasiness that comes and goes to more pronounced nausea affecting appetite and nutrition. Healthcare resources, including the NHS and GoodRx documentation, note that taking gabapentin with food may help prevent or minimize nausea and vomiting. The FDA prescribing information acknowledges gastrointestinal adverse reactions in clinical trial data. These symptoms often appear early in treatment, similar to many other gabapentin side effects, and may improve over time as the body adjusts. However, for some individuals, nausea and digestive upset persist, potentially affecting medication adherence and treatment success. When these gastrointestinal symptoms occur alongside other side effects like dizziness or drowsiness, they create a compound effect significantly impacting quality of life. Healthcare professionals note that strategies for managing these effects include taking medication with meals, adjusting dose timing, or implementing slower dose escalation schedules. Next, side effect 10, respiratory depression and breathing difficulties. We conclude with the most serious side effect carrying potentially life-threatening implications. Respiratory depression and breathing difficulties, while less common than other effects we've discussed, represent a critical safety concern that prompted FDA warnings. On December 19, 2019, the FDA issued a drug safety communication specifically warning about serious breathing problems with gabapentin. The agency reviewed cases from the FDA Adverse Event Reporting System database and medical literature, identifying reports of serious, life-threatening, and fatal respiratory depression associated with gabapentin use. The risk dramatically escalates when gabapentin is combined with opioid pain medications, benzodiazepines, or other central nervous system depressants. Clinical trials in healthy individuals showed gabapentin alone increased pauses in breathing during sleep, while combinations with opioids significantly worsened respiratory depression. Observational studies at major medical centers demonstrated relationships between preoperative gabapentin administration and postoperative respiratory depression, with one study showing 60% increased risk with regional anesthesia and 47% with general anesthesia. Patients with underlying respiratory conditions, such as chronic obstructive pulmonary disease or sleep apnea, face elevated risk even when taking gabapentin alone. The mechanism involves gabapentin's ability to depress neural activity in brain regions, controlling respiration, dampening automatic signals, regulating breathing rate and depth. Warning signs include unusually slow or shallow breathing, excessive drowsiness, confusion, and bluish discoloration of lips or fingernails. The FDA now requires manufacturers to add warnings to prescribing information and conduct clinical trials evaluating abuse potential and respiratory effects, particularly when combined with opioids. We've journeyed through 10 scientifically documented side effects of gabapentin, from common experiences like dizziness and drowsiness to the serious concern of respiratory depression. Understanding these potential effects empowers you to make informed decisions about your healthcare and recognize symptoms that may require medical attention. If this video provided valuable information that helps you better understand gabapentin and its effects, I'd really appreciate it if you would type "helpful" in the comments below. That simple word motivates us to continue creating evidence-based content backed by authentic medical research. If you found this information useful, please give this video a thumbs up. It helps others discover this content when searching for answers about their medications. Share this video with friends or family members who might be taking gabapentin or considering it as treatment, because informed patients make better health decisions. And if you haven't already, please subscribe to our channel and turn on notifications so you never miss our upcoming videos covering important health topics backed by real science. Remember, this information is meant to educate, not to replace professional medical advice. Always discuss any concerns about your medications with your healthcare provider before making changes to your treatment plan. Thank you for watching, and stay informed and healthy.